Okay, so I'm going to attempt to go through the medications that you're going to leave the hospital with. So pardon some of my pronunciations if I'm not correct, but I'm going to try my best. So I'm going to start with what you're going to take for anti-rejection because that's going to be your most important medications. This is something that you don't want to vary on the times that you're going to take them. You're going to have to take them twice a day, in the morning and at night, and do the exact dose that you're supposed to take until clinic or your doctor tells you to change the dosage. You will be taking tricolomus. Tricolomus will be a little pink and white pill. Okay. You will be prescribed 2 different dosages of this. You'll be giving a 1 milligram pill, and you'll also be given a 0.5 milligram pill, because just in case your dosage changes during the first month particularly, that you'll be going to clinic, they'll give you enough pills for that period. Or if they have to increase it, lower it, or whatever, depending on what your numbers are. So the tricolomus is also what people call Prograf. So get familiar with both of those names. That's going to be very important for you, okay? The next one is your Celsep, all right? Celsep or mycophenolate or Celsep is your other anti-rejection medication. So this is a large pinkish purple pill. All right, you're going to take 2 tablets of this twice a day. That's what they're going to originally probably give you. Or whatever your dosage is. Once again, make sure you take it as your doctor prescribes. You'll take this both in the morning and in the evening. So stay on top of that. Of course, your anti-rejection med that a lot of people don't like, but it's a necessary evil, is the infamous prednisone. Okay, so you'll be taking a high dosage of prednisone to start. What they're doing to me, and I assume this is what they do typically with transplant patients, is they'll be reducing it by 5 milligrams every week. So this coming Friday, I'll take 5 pills instead of 6. So this is my anti-rejection drugs, the 3 of these. All right. So then for preventing any type of viruses or bacteria, anything during the first to 3 months, there's a series of medications that you'll be taking also. Bactrim, pretty popular. That's one that that you'll be taking. Let me grab the Bactrim so you'll know what that looks like. All right, Bactrim is just a little white pill. I'll take these once a day. I take it at night. All right, another one that they gave me is Valsite. Okay, Valsite, I take that in the morning. This one treats infection. The Bactrim does too. They're both infection preventing medications. Okay. I have a stop date for the Bactrim of October 30th. They said the Valsite will be stopped with clinic. They'll tell me when to stop taking that one. The Valsite is for the CMV disease. So they told me in the hospital that most Americans have been exposed to CMV. So you're in better shape as a transplant patient if you've been exposed to it prior to your transplant versus if you haven't. I have been exposed and my donor has been exposed. So that's a good thing for me. But still, they're going to let me know during clinic when to stop taking it. You also will be taking Mycelex 3 times a day. This is to prevent fungus infection, also thrush on the tongue. So you just will take this and let it dissolve in your mouth for like 15 minutes and not eat any food or drink anything while you're trying to let it dissolve and make sure your mouth is nice and coated. So that one's nice and easy. I usually take it probably an hour or so after I eat so that I know I'm not hungry, I'm not thirsty or anything, and I don't get distracted and have a sip of water or a snack when I should just be letting the Mycelex work. Then there's a Pepcid pill that you'll be taking, of course, to try to keep your stomach coated. Where's my Pepcid? There it is. You'll take a Pepcid at nighttime. So the Pepcid is for nighttime. That's when I have it prescribed. This is going to be for 1 month. Okay. And then it says take it whenever I need it. Like if I feel I need to buy some Pepcid over the counter, of course, I could just do that after that first month. Okay, so then for my blood pressure, because one thing, of course, as you know, excuse me, most kidney patients have high blood pressure. That can or cannot change after your transplant. So what they want to make sure is that your blood pressure is regulated after you have the transplant, and you don't necessarily have some type of high number just randomly. So to just keep it under control, you're taking a very low dosage of baby aspirin. So this, of course, is a over-the-counter medication, but you'll leave the hospital with a prescription. So this is 81 milligrams of aspirin. And to go along with it, I have a very low dosage of amlodipine. So this is a blood pressure medication that is 5 milligrams. So it's extremely low. My blood pressure has been, the highest has been 140 over 100. So of course that's high. That 100 number is horrible. So driving it down, the last few readings have been between 135 and 139 top number, and the bottom number is sitting right at 90. So I'm thinking they're probably going to change this dosage a little bit when we go on tomorrow to clinic, but we will see. So that's all my medications. I'm used to being used to having medications on a program, just like I'm sure you are, because you've been taking medications as a kidney patient. So don't slack on these. There's also a great app I found online for transplant patients that you could just remind yourself on your times. You could put all your medications in and everything. So find what works for you to remember to take your meds. When I left the hospital, they gave me this great little medicine pack. I'm sure you'll get one too. I have it only loaded up until tomorrow. I left the hospital with Friday, Saturday, Sunday, and Monday loaded. And I only have it loaded till here because tomorrow I go to clinic. And more than likely, they'll change the medication dosages on some of these medications. So stay on top of your meds. Thanks.